Good day, ma'am and sir. My name is Gwyneth Marietta T. Cabilino, a second-year BS in nursing student from the University of Mindanao. Today, I will perform the urinary catheterization for a male client. It is the introduction of a urinary catheter through the urethra into the bladder for installation or removal of fluids. Check the doctor's order. This is to ensure that the client has a medical order for Okay, you can go back now. Place the client on a supine position with feet apart and drape the client. Good visualization of the meatus is important. Embarrassment, chillness, and tension interferes with the introduction of the catheter. Okay, Mr. Gray, right now I want you to separate your legs. Okay. Prepare the urine receptacle and tubing if an indwelling catheter is to be inserted. The tubing facilitates in connecting the catheter to the drainage system. Open the pack and bring it near the perineal area. Placement of the equipment near the worksite increases efficiency. Observe aseptic technique. Sterile technique protects the client and prevents the spread of microorganisms. Squeeze a small amount of lubricant over the sterile gauze placed in the sterile field. Organization promotes efficient time management. Using sterile pickup forceps, get 2 cotton balls with betadine aseptic solution from the sterile jar and place on the sterile field on top of the several gauze. Open the wrapper or plastic cover of the sterile specimen bottle and drop it on the sterile field. Wash hands and put on working gloves. Hand washing prevents the spread of microorganisms. Put on sterile gloves. This is to avoid cross-contamination of microorganisms. Do perineal care or flushing and discard working gloves after cleaning the perineal area. Okay, Mr. Gray, I will pull up the cover and I will going to do the perineal flushing first. Cleansing the perineal area prevents the introduction of bacteria. Grasp the upper corners of the fenestrated or eye drapes and unfold it. Place the fenestrated drape aseptically over the perineal area with penis extending through the opening. A drape provides a sterile field where the equipment and the hands will be placed. Holding the penis with a non-dominant hand, disinfect the meatus twice using cotton balls with betadine aseptic solution. Starting from the top, use a circular motion stroke, then downward for each cotton balls and discard. This cleans the area and minimize the risk of urinary tract infection by removing surface pathogens. Lubricate 6 to 8 inches of the catheter tip. Avoid clogging the lumen. Lubrication facilitates the insertion of the catheter and reduces trauma to the tissue. Hold the penis perpendicular to the body and pull up gently. Alright, Mr. Gray, I will put the catheter. Hold the catheter with a non-dominant hand. Insert about 8 inches until urine is noted in the drainage bag or tubing. Advancing an indwelling catheter an additional 1/2 or 1 inch ensures placement within the bladder and facilitates the inflation of the balloon without damaging the bladder if it is a Foley catheter. Do not force the catheter through the urethra. Okay, Mr. Gray, can you breathe in? Ask the client to deep briefly and rotate the catheter if resistance is met. Hold the catheter with your non-dominant hand while the bladder empties. Collect a specimen of 20 to 30 ml if required. Continue drainage according to the hospital policy. If a straight catheter is used, remove the catheter smoothly and slowly. The catheter is only needed to drain urine present in the bladder and is not intended for continuous use. If a Foley catheter is used, introduce 5 cc of distilled water to secure the catheter or follow the manufacturer's